Hi, everyone. I'm Sherry.
Hi, I'm Nadia, and today we will be discussing domestic violence as it pertains to male victims and survivors.
We are here to train the professionals within our agency who lack knowledge around male victims of domestic violence. We are educating our peers on domestic violence against male victims. Domestic violence, also known as intimate partner violence, occurs between people who are or have been in a close relationship. Domestic violence can take many forms, including emotional, sexual, and physical abuse, stalking, and threats of abuse. It can happen in heterosexual or same-sex relationships. Abusive relationships always involve an ambivalence of power and control. An abuser uses intimidating, hurtful words and behaviors to control his or her partner. Statistics show that domestic violence permeates every classification of people in the United States: rich and poor, young and old, heterosexual and homosexual, and every other classification of individuals are affected by domestic violence. Likewise, both women and men can be victims of domestic violence. Violence against men is something that is rarely talked about, and if it does come to light, it is highly ridiculed by society. Believe it or not, there are many men who are suffering in silence, who are reluctant to report abuse because they feel embarrassed, fear they won't be believed, or are scared that their partner will take revenge. An extensive amount of stigma and mockery around the topic is what makes it taboo, rarely being viewed as a problem. If you're a man in an abusive relationship, it's important to know that you're not alone. Abusive men happens far more often than you might expect in both heterosexual and same-sex relationships. It happens to men from all cultures and all walks of life, regardless of age or occupation. Studies have shown that as many as 1 in 3 victims of domestic violence are male.
Society has been conditioned to only view males as the perpetrator of intimate partner violence and women and children as the victims. Studies, education, and research tools have been created within the lens that males are the perpetrator and women are the victims. We often overlook men in the same-sex relationships or individuals who identify as trans men, teen boys who have experienced abuse in dating relationships, and men who are incarcerated. We must broaden our knowledge and understanding of gender variations as it relates to intimate partner violence. Abuse can take many forms, such as being controlled by the partner, belittled, being yelled at, or physically assaulted. Domestic violence against men is violence or other physical abuse experienced by men in a domestic setting, such as in a marriage or cohabitation. Violence against men may constitute a crime, but laws vary between jurisdictions. Men who report domestic violence can face social stigma regarding their perceived lack of machoism or other denigrations of their masculinity. Determining the rate of intimate partner violence against males can be difficult, as men may be reluctant to report their abuse or seek help. Male victims of violence may face sociocultural issues such as judgment by male peers, fear of coming out as LGBTQ, or having their masculinity questioned. Intimate partner violence against men is generally less recognized by society than intimate partner violence against women. For some men, admitting they are the victim of female perpetrated intimate partner violence could feel like admitting that they do not follow the established social role for men, and may be an admission they are unwilling or unable to make. Attachment theory can provide some insight into the dynamics of an abusive relationship. Individuals who have had consistent experiences of insecure attachment as a child and as a young adult will most likely form strong attachment bonds with others despite the quality of the relationship. In abusive relationship, both partners will tend to have insecure attachment styles. as they both often have a fear of abandonment and rejection. The abusive partner will often be very dependent on their partner and will use anger and rage when their fear of abandonment gets triggered. The abused partner will then take on the shame and feelings of inadequacy.
Physical impact of intimate partner violence. While it may not seem like a big deal to many, an abusive partner may hit, kick, bite, punch, spit, throw things, or destroy possessions. To make up for any difference in strength, they may attack while you're asleep or otherwise catch you by surprise. They may also use a weapon such as a knife or strike you with an object, abuse or threaten your children, or harm your pets. Domestic violence is a serious problem in the United States. Statistics show that women are victimized at a much higher rate than men are. However, the National Coalition Against Domestic Violence reports that approximately 835,000 men are physically abused by an intimate partner each year. This organization also reports that about 20 people are physically abused by an intimate partner in the United States every minute. This results in about 10 million men and women being victimized each year. Additionally, 1 in 3 women and 1 in 4 men report being the victim of some type of physical violence by a romantic partner at some point in their lifetime, with 1 in 5 women and 1 in 7 men reporting the abuse as being severe physical violence. Men report many of the same problems associated with domestic violence as many women do, including instances of stalking. Approximately 5.1 million men report being stalked at some point during their lifetime. 1 in 20 male murder victims were killed by an intimate partner. Additionally, 1 in 71 men report being raped by someone they know, and 29% of these men said that the rape was committed by an intimate partner. Victims of intimate partner violence are more vulnerable to contracting HIV or other STIs due to forced intercourse, and they are also at a higher risk for developing addiction to alcohol, tobacco, and drugs as a means of escape or forgetting the pain they have experienced. Some of the emotional impact of intimate partner violence. Domestic abuse is not limited to violence, but emotional and verbal abuse can be just as damaging. Your spouse or partner may do the following. They may belittle you or humiliate you in front of friends, colleagues, or family, or on social media, be possessive, act jealous, or harass you with accusations of being unfaithful. Take away your car keys or medication, try to control where you go and who you see, try to control how you spend money, or deliberately default on joint financial obligations. Make false allegations about you to your friends, employer, or the police, or find other ways to manipulate and isolate you. They may also threaten to leave you and prevent you from seeing your kids if you report the abuse. This can lead to decreased self-worth as society views men as being able to protect themselves and will promote a culture of men not wanting to share or report their experiences.
Psychological impact. These are some effects of domestic violence. Men suffer many of the same effects as female victims of domestic violence. Domestic violence correlates to alcohol and drug abuse, higher rates of suicide and depression episodes. Men may also suffer physical injuries inflicted by intimate partners. Domestic violence can leave you depressed and anxious and can increase your risk of having a drug or alcohol problem. Because men are traditionally thought to be physically stronger than women, you might be less likely to report domestic violence in your heterosexual relationship due to embarrassment. You might also worry that people will minimize the importance of the abuse because you're a man. Similarly, a man being abused by another man might be reluctant to talk about the problem because of how it reflects on his masculinity or because it exposes his sexual orientation. In order to combat domestic violence, it is important to recognize the signs of domestic violence. Some signs of an abusive relationship include the intimate partner calls the victim's names, insults him, or constantly criticizes him. The intimate partner tries to prevent the victim from leaving the house, getting a job, or going to school. The intimate partner isolates the victim from friends or family. The intimate partner threatens to out a gay, bisexual, or transgender person. The intimate partner acts jealous or accuses the other party of misconduct. The intimate partner makes a threat or mentions of having a weapon. The intimate partner physically harms the victim by hitting, punching, slapping, biting, choking, kicking, or otherwise inflicting physical harm. The intimate partner abuses or threatens to abuse the victim's child or pet. The intimate partner forces the victim to engage in unwanted sexual behavior. The intimate partner blames the victim for his or her behavior. Studies suggest that there is a relationship between interpartner violence and depression and suicidal behavior, PTSD, chronic pain, anxiety. 4 in 10 males have experienced psychological abuse. This includes isolation from friends and families, manipulation, threats, and economic control and exploitation. Domestic violence can also have a social impact. There is a problem with male victims in reporting instances of violence. Women are 7 to 14 times more likely to report domestic violence than men are. This underreporting is possibly due to stereotypes regarding men and women. American culture emphasizes male domination, prowess, and strength. Being a victim of domestic violence does not correspond to this stereotype. Gender norms associate men with being naturally stronger than women, causing many men to believe that they can handle the situation, choosing not to report the events. Much of the discourse regarding domestic violence is based on women victims. When men do report instances of domestic violence, law enforcement officers may not take the allegations seriously. There are far fewer resources available to assist male victims of domestic violence than there are to assist female victims of domestic violence. Some men may be afraid that if they report domestic violence, they may even be accused of inflicting the abuse. Researchers have demonstrated a degree of sociocultural acceptance of aggression by women against men, as opposed to a general condemnation of aggression by men against women. Male on female intimate partner violence has been shown to cause significantly more fear and more severe injuries than female on male violence. This can lead to men not considering themselves as victims and or not realizing the intimate partner violence they are experiencing is a crime. The impact of domestic violence against men can affect the man's sense of self, leaving him helpless or frustrated. Experiencing violence from a spouse who has anger issues or behavioral issues could make it difficult for a man to face or deal with the situation. The helplessness could be a recurring feeling, further leading to low self-esteem and depression. This could increase his risk of addiction to alcohol and smoking. This could in turn lead to serious mental health issues such as depression or anxiety, and physical health issues like heart disease and respiratory problems. This could lead to anger issues, depression, suicide, making it difficult for themselves and their loved ones to cope with. It could also lead to difficulty in functioning. Simple everyday activities such as completing tasks, remembering details, being on time become difficult to completing tasks, remembering details, and being on time can become difficult to carry out. This could also make him prone to several physical and mental health issues. Hypertension, depression, anxiety are just some of the conditions that could affect the person. Excuse me.
Creating a safety plan is of importance, just as how women need safety planning, men also need the same safety planning as well. The plan does not differ because it's a man. Some of the safety planning that could be enforced with your client is to discuss the fact that leaving an abuser can be dangerous. Consider taking these precautions. Call a domestic violence hotline for advice. Make the call at a safe time when the abuser isn't around or from a friend's house or other safe location. Pack an emergency bag that includes items you'll need when you leave, such as extra clothes and keys. Leave the bag in a safe place. Keep important personal papers, money, and prescription medications handy so that you can take them with you on short notice. Have a plan of exactly where you'll go and how you get there. Domestic violence against men can have devastating effects. Although they may not be able to stop your partner's abusive behavior, you can seek help. Remember, no one deserves to be abused. As an abused man, you may face a shortage of resources, a lack of understanding from friends and family, and legal obstacles, especially if you're trying to gain custody of your children from an abusive mother. Whatever your circumstances, you can overcome these challenges and escape the violence and abuse by seeking therapy and talking to someone you trust. After the trauma of an abusive relationship, it can take a while to get over the pain and bad memories. But with the continued support of a therapist you trust, you will begin to heal from the trauma.
Where to seek help. In an emergency, call 911 or your local emergency number or law enforcement agency. The following resources also can help. Someone you trust. Turn to a friend, relative, neighbor, coworker, or religious or spiritual advisor for support. You also can contact the National Domestic Violence Hotline, 1-800-799-SAFE. The hotline provides crisis intervention and referrals to resources. Your healthcare provider, doctors and nurses will treat injuries and can refer you to other local resources. A counseling or mental health center. Counseling and support groups for people in abusive relationships are available in most communities. A local court. Your district court can help you obtain a restraining order that legally mandates the abuser to stay away from you or face arrest. Local advocates may be available to help guide you through the process. This concludes our training on violence with males as the victims. Thank you.